One of the things that I like best, and the reason I chose my profession, is that colon cancer, it's one of the most common cancers in the United States, but it's also one where there's a lot of opportunity and a lot of chance to make a difference. When a patient comes to me, they don't know anything except for that there was a mass or a tumor found in their intestine. So the first visit is really trying to assess what a patient knows. We talk about most important parts are the diagnosis, so the pathology results. Then we talk about clinical staging, and that's getting x-rays, CAT scans, or other imaging that helps me figure out, exactly where the tumor is and understand the potential clinical stage it's at. Once we do that, then we plan for surgery. Planning for surgery often includes having a conversation about what the next steps are, what the surgery entails. Then we get them ready for surgery, and it depends a little bit on their health status. So if a patient is already healthy, then we plan surgery. If they're sicker, then we try and do things. I tell patients that having colon surgery is a little bit, or having any surgery is a little bit like training for a race or a marathon. You want to get as strong and as fit as you can before it happens so that you recover faster afterwards. And then we really focus the first few days after surgery on recovery. That recovery period is really important. Getting healthy, getting your energy back up after recovery. Most of the time for colon cancer, we follow patients very closely for the first 2 years after their surgeries. I tell patients we're going to be best friends for a couple of years. You're going to see me every 3 to 6 months for the next couple of years, and then you get a high five or a hug at the end of 2 years, because the most common time for colon cancer to come back is in those first 2 years. I think the collaboration of teams in care is it's essential to colon cancer care, and I think we have a very unique spin on it because we do so much in the way of innovation. All the screening methods for any disease process, colonoscopy actually prevents cancer and can treat early cancers.